Hello, my name is Dr. Rob Endicott of Midlands Dental Sedation Services, and welcome to my patient consent video. This is just a broad overview of what's involved with intravenous sedation. Please make sure you look through our consent form just to make sure you're absolutely happy with everything, and please feel free to ask any questions before we begin. So what is intravenous sedation? Intravenous sedation is a very safe way of helping you to stay very relaxed and comfortable during your dental treatment. Intravenous sedation is also referred to as conscious sedation, which means that you aren't actually totally asleep. You are actually right on the edge of sleep. If we were completely asleep, that would be a general anesthetic. But this is conscious sedation. You are very, very relaxed and comfortable, and you're able to respond to some simple commands like opening your mouth and turning your head and that sort of thing. Sedation is a great way of making you feel comfortable if you are slightly anxious of having dental treatment, all the way to if you're absolutely petrified of having dental treatment. It's also a great way if you're having major work done that might take a few hours. It's a great way of being able to condense that down, so to you it would feel like it's about 10 or 15 minutes worth of treatment. When you get anxious about something, especially dental treatment, that ends up being like an upward curve. So you start off being a little bit anxious, and then it just increases and increases and increases, and it can get to the point with a lot of people where it gets towards a panic attack. Now, what happens with dental sedation or intravenous sedation is that when you start to get a little bit anxious, it helps you to forget that you are actually anxious, and the anxiety level goes back down again. So what happens is you end up being on this nice, slow, low level of comfort all the way through your procedure, and you don't get given the opportunity to actually become more and more anxious and for it to get out of control. This effect can last between sort of 1 and 4, sometimes even 5 hours, and we can keep you topped up as we go along. So before your treatment session, we always recommend that you have a light meal so that you're not feeling hungry, because hunger can increase your level of anxiety. Talk to us beforehand if you feel ill in any way, if you've got a blocked nose. Sometimes we need to use a little bit of oxygen and pop a little thing on your nose. So we need to know if you are having trouble breathing, or if you generally feel unwell, and then we need to reschedule the session for you. Make sure as well that you wear loose and comfortable clothing. Throughout the procedure, we will be monitoring you. We will have a blood pressure cuff on your arm. So we need to make sure that we can get access to your arm, as well as to get access to your veins as well. If you could avoid nail polish, that tends to interfere with our monitors quite a little bit. And the important thing to remember throughout all this is that you need to bring somebody responsible with you who's over the age of 18, who can look after you for a few hours after the treatment. With intravenous sedation, how it works is we introduce a little cannula into a vein. We tend to use it in your forearm mostly, which is the most comfortable place to do it, but if we can't find a vein there, then we can tend to use the back of the hand as well. Once the cannula is in, we just gradually ramp up the sedation until you are lightly snoring or just looking very, very relaxed and comfortable. And if you're able then to receive a local anesthetic in your mouth without even noticing it, then we know you're at the right sort of level. So what to remember after your treatment: make sure someone is at home with you for a good couple of hours to take care of you. Make sure you're not going up and down stairs. Make sure you follow all the instructions we give you, and we'll give you a printed copy of those instructions for whoever's coming with you. Avoid anything that involves any kind of responsibility, so no writing checks, changing wills, driving a car, being solely responsible for children. You will be feeling quite tipsy afterwards for a good few hours, and you'll probably just want to go home and have a little rest on the sofa and watch telly for a bit. Intravenous sedation is a very, very safe procedure, but there are always risks associated with any medical procedure. Very, very rare risks are things like nausea and feeling sick afterwards. I've certainly come across that once in the last 3,000 cases. You can often get bruising around the injection site where we've put in the cannula. Breathing rate will be slower, your blood pressure will be lower, your pulse rate will be lower. You will certainly be feeling lightheaded because you will be quite tipsy afterwards, so that's a completely normal feeling. But fortunately there's no hangover associated with intravenous sedation, so your recovery will be nice and gentle and nice and comfortable. Of course, remember that your mouth will probably be numb, and sometimes it can be numb all the way around, so be careful with hot drinks and make sure you follow any instructions that your dentist gives you afterwards. The alternatives to intravenous sedation: you can just have your treatment under a local anesthetic, which will of course numb the teeth and numb the gums, so you shouldn't feel any pain during the treatment. There is a technique called relative analgesia, or some people call it happy gas, which is nitrous oxide. That's something that some referral centres can provide for you, and that's a great way of treating mild anxieties and gag reflexes and that sort of thing. And then of course you've got the option of a general anaesthetic. So if intravenous sedation isn't suitable for you, you can be referred to hospital for a general anaesthetic where some simple treatment can be carried out, like tooth removal and surgical procedures. Just some simple information for the person who's bringing you to the dental visit. Make sure as a carer you have no alcohol that day, because we don't want you being tipsy at the same time as the patient being tipsy. Make sure you help the patient if there are any steps up into the house. Make sure you hold them under their arm. Make sure they're nice and safe. Do expect that there will be some amnesia from the patient. The dental sedation helps them to forget at each and every stage what's going on. It's almost like being asleep. And that amnesia can carry on after the treatment session. So don't expect the patient to be remembering much for a good few hours afterwards. Make sure the patient doesn't do any household chores because they won't be done very well. And make sure that they do not leave the house unaccompanied. And do remember, if you have any questions at all about the treatment, either as a patient or a carer beforehand, please feel free to ask and we would be delighted to help.